I have been a Da Vinci surgeon since 2001. I'm averaging about 120 to 150 major robotic procedures per year. Well, the focus has really been in the area of complex hysterectomy, as well as advanced endometriosis surgery and reproductive surgery, particularly uterine reconstruction when it comes to performing myomectomies or removal of fibroid tumors. Well, the benefits, first of all, lie in the fact that myomectomy in this country is traditionally done by an open technique or a laparotomy where the patient has a large incision on her abdomen. What the Da Vinci surgical system brings to the table is the fact that now you can offer that procedure in a less invasive fashion through smaller incisions with a much quicker recovery. In fact, patients can go home the same day. What we've seen in our very own data is that we are at least equal to, if not better than, the traditional techniques that are done either open or with conventional laparoscopy. So we're seeing that patients not only have the benefit of a less invasive approach, they go home the same day, but those patients who do choose to get pregnant are actually able to conceive, provided there are no other factors that are involved in their infertility. That leads very nicely into endometriosis, for example. It's another area where the Da Vinci surgical system brings a lot of advantages, but now with the improved visualization that we have of the operative field, the articulation of the instruments that we have at the tips of our hands that we control through the robotic interface, we're now able to more aggressively tackle some of these more complex cases of endometriosis in our patients. One of the biggest really responses I get is how thankful they are that they were able to undergo these procedures minimally invasively. They'll have seen numerous other surgeons who will have offered them only one option, which is an open technique, or they'll only offer them one option, which is loss of their uterus, which for many women is not an option, particularly if you want future fertility. So the fact that they can undergo a procedure minimally invasively, take advantage of a technology such as the Da Vinci surgical system to really improve their quality of life, it's a tremendous sense of elation that patients have, particularly since they're also empowering themselves. Many of these women will come to us because they've done the research, they recognize that there are options out there, and it's very empowering for women to not only find their Da Vinci surgeon, but then also undergo the procedure and obtain the results that they were seeking, which is a less invasive procedure, sparing of fertility, relief of pain, rapid recovery. I mean, all of those things are very important to the women that we take care of. I can certainly honestly tell you that if I have to recollect right now the last time I transfused a patient, it's going to be difficult for me, because we just rarely have to do it because it allows us to be that meticulous and precise when we do both simple and complex surgery with the Da Vinci surgical system. Certainly we're not out here to push patients to go home, but it is interesting. They feel so well post-operatively that patients don't really want to be in the hospital. This minimally invasiveness that's afforded to us by the Da Vinci surgical system has really allowed us to take our surgical care to a whole new level. Is Da Vinci surgery for every patient? No, it's not for every woman. There are a lot of variables that go into determining who's a candidate, but certainly you'll be surprised to find out that women who may have thought that they're not a candidate actually are once they do a little bit deeper digging and see the right doctor and have things explained to them in a way that makes sense, that they can understand. I'm a Da Vinci surgeon because of the benefits that it brings to my patients, particularly when it comes to complex surgery. Seeing the rapid recovery, the return to their activities of daily living, and improvement in quality of life